Hello, and welcome to Women's Health. Women's Health is a series of programs that is sponsored by and hosted by the Women's Foundation of Lincoln and Lancaster County. My name is Kathy Ermacher. I am the president of the Women's Foundation, and I'm joined today by Sydney Gaines, who is here to talk to us about a very serious topic, and that is infant and maternal mortality in the Black community. Just recently, the Flatwater Free Press did an analysis of federal data and found that Nebraska had the fourth highest infant mortality rate for babies born to Black mothers in the country between the years of 2019 and 2023, and that Black babies were 2.5 times more likely to die in their first year than babies born to white mothers, who also had a mortality rate higher than the national rate. We also know that Black women died while pregnant within the first year of their pregnancy at 3 times the rate of Hispanic women and nearly 2 times the rate of white women. And these are according to state's most recent maternal health or death reviews. So this is a very serious topic, and we really want to talk today about some of the reasons for that, what are some of the consequences, and what are some of the things that can be done to improve this. I'd like to have Sydney tell you a little bit more about who she is and what she does. Sydney is an employee of the Malone Center, but she also has a lot of other roles. So Sydney's going to tell you a little bit more about who she is and what she does.
Awesome. Thank you, Kathy, so much. Yes, my name is Sydney Gaines. I'm the Assistant Director for Malone Maternal Wellness at the Malone Center. I coordinate our satellite office in Omaha, even though our primary office is in Lincoln. I'm also one of our doula mentors on staff to provide leadership and mentorship to our partnering doulas with our organization. And I'm also a full spectrum doula myself, providing advocacy, empowerment, education, and information and support to families in need of in the birthing space.
Okay, thank you and welcome. And thank you so much for being part of this program. You're certainly a very important part of this. So let's talk about the causes. What are some of the causes of these discrepancies between the infant and maternal mortality rates of Black women?
Yeah, I think there are a lot of factors that go into the impact of infant and maternal mortality rates. I think the glaring one is the systemic racism that's kind of built into our healthcare system, and not just in our healthcare system, but in all areas of life. So we look at the social drivers of health, access to transportation, access to education, access to healthcare, access to employment and income, access to insurance, which is tied to employment oftentimes. All of those things are significant contributing factors in folks accessing the healthcare system, regardless of education or socioeconomic power. The healthcare system is difficult to access at any stage. And so for me, it's no wonder that those statistics are as glaring as they are. And while the statistics in Nebraska aren't great either, our discrepancies aren't just related to race and ethnicity, but they're also tied to geographic locations. So if we think about the state of Nebraska is considered a 51% maternity care desert, which means folks in rural and western Nebraska, folks in those communities have even less access than folks maybe in Lincoln, Lancaster counties, in Douglas and Sarpy counties. So there's a lot that plays into why those statistics are so high.
But I think our audience will be shocked to hear that it is as high as it is. And I think that we as Nebraskans think, oh, well, we've got, pretty decent health care, blah, blah, blah. But that's not, in this case, it's really important to talk about what the reasons are for the huge discrepancy there and what we can do. So let's talk about what can be done. What are some of the efforts now, Malone and others, where you're working very diligently on this issue?
Yeah, I think there's a lot of organizations and a lot of community groups at various levels who are looking to address these discrepancies and these disparities among Black, African American, Indigenous communities, other communities of colors, because they're deeply impacted by this. So you'll see grassroots organizations like the Malone Center, like A Mother's Love, like Omaha Better Birth Project, who are working to tackle these discrepancies by providing childbirth education. We know that childbirth education, statistically, those folks who take that are likely to have better birth outcomes.
So this is like a Lamaze class or something like
Similar
that?
to a Lamaze class. I know for the Malone Center, we offer evidence-based birth education. So what they do is taking a look at the research and helping people kind of sift through that information, because research can be really heavy and dense, and making it more accessible to regular community members who maybe aren't in the medical field. So that way those folks have the information that's backed by research and they can make the best choice for them.
So pre-birth classes,
Correct,
basically.
yes, pre-birth
and not
classes.
just something easy, or not easy, but something normal like Lamaze, which everybody's heard about. There needs to be more pre-birth classes.
Yes, to really understanding what your options are, what can labor and birth look like for different people, whether you're low risk, high risk, if you're, hoping to have a vaginal birth, or if you're having a cesarean. There are things that you can educate yourself on to prepare for those kinds of experiences. And those classes aren't just about childbirth, they incorporate postpartum education. People spend so much time preparing for the birth and labor part, because that usually feels really intimidating and it's a really vulnerable experience, that they get home in this baby and they go, okay, now what? Now what do I do? How do I parent? How do I, tell the difference between my baby's cries? How do I know when they're hungry? Is this amount of, blood, normal after I'm home after having a baby or having a cesarean? So really talking about all of those things to help people understand what their options are, understanding maybe what's normal, maybe what not be normal, when to call your nurse or provider to ask for additional support and help, but also recognizing when is it time to access mental health support. So many people, I think it's 1 in 3 people, suffer from a postpartum or perinatal mood disorder, either during pregnancy or in the postpartum period. And if we look at the national data, most of those deaths, the maternal deaths that happen in that first year postpartum, whether that be from a medical event or from a perinatal mood disorder. So that childbirth education isn't just about what to expect during pregnancy, birth, but also what happens postpartum, when to call your doctor and ask for more support and help.
That is so important, because there's a lot of discussion now about postpartum depression. And I think it's important for people to realize that that's a very important part of the process, and when to recognize it. Because sometimes you don't recognize it yourself, but those around you needing to be able to recognize it. So that's really good. So you mentioned a couple of organizations. What other things do you think we can do? What are some things that are happening that are helping to improve it? Because I think recently I've heard that the statistics are a little bit better than they were in 2023. So what are some of the things that are making a significant difference besides the classes?
Yeah, so I think those grassroots organizations continuing to provide direct service, there you can see immediate change. Whereas that local government, state legislature, it's a long and slow process. There's a lot of red tape for change to come through the medical system that way. So those direct service organizations are going to be instrumental in combating some of those disparities and inequities that are happening for pregnant and parenting people. And then you'll see things like the fetal infant mortality review committees, the maternal mortality review committees, who are looking at what's really happening, going through the data of every single case of what's happening, why we are losing so many people, and looking at, okay, if we know that these deaths are a result of X factor, then we can address it with method A, B, C. Again, whether that's through a direct service, whether it's changes to our medical system, whether it's changes to insurance and what insurance will cover, how do we address those things, and talking to those MCOs about addressing those issues as well.
And we will be listing some of those organizations and their contact information at the end of the program. So if our audience wants to hold on till the end of the program, we'll make a list of some of those organizations and how they can be contacted, because I think knowing that information is really helpful. So you mentioned insurance, and you had mentioned some other things that are really policy driven. And So there are hands-on classes, and those kinds of things are really important, one-on-one with the mothers and the families. But then what about institutional things that can change? What are some of the things that could happen on the national level that could make a difference for the birth rates here in our little state of Nebraska? So what do you see is something that the national level could do, or some of the maybe concerns about on the national level that's policy that could make a difference in this?
Yeah, I think there are several things. I think one of the biggest things that jumps out to me, in addition to Medicaid's service, is paid parental leave. People need time off to be able to care for their children, especially postpartum, and not just for the birthing parent, but also for partners and family members who are primary caregivers who are caring for infants and newborns. I think when it comes to Medicaid, getting rid of Medicaid is not the solution. So many people use that as a way to support themselves through pregnancy and postpartum. And when people lose access to Medicaid, when they lose access to insurance, they're less likely to go to their prenatal appointments and get the care that they need. They're less likely to use other social services, due to stigma or lack of access, which means they're probably not accessing healthy groceries, meaning it impacts their nutrition, which impacts their lifelong health. So it's really important that we have these programs available to people who need it, because the people who need it are accessing it. And because they have that access, they're able to get better care. They're more likely to go to their appointments and be able to care for their families. And so I think it's really important on the national level to make sure those folks who are kind of left on the margins and forgotten about, those low-income folks, those folks without, adequate housing, folks without steady employment, have access to health care.
Right. Because if the statistics are that, approximately 3/4 of the mothers are using Medicaid, then it makes sense that it's a national situation as well as a local situation, and that help from the national government as well as the state government is going to be important to it. And I also think that we forget about the nutritional aspects of it. Just having healthy food, just being able to access healthy food is a really important thing. So even that is part of the SNAP program and a lot of other things, so that they can really make a lot of significant difference. And it does sound that once Medicaid expansion was instituted in Nebraska, that really helped a lot in these areas. So that's something to think about. I think we have to realize that policy does make a difference. Yeah. All right, so let's talk a little bit more about what do you think on the state level? I mean, I understand that Medicaid is partly a state issue and SNAP is partly a state issue, but are there other issues within the state of Nebraska that need to be addressed?
Yeah, I think, access to healthcare is going to be kind of the glaring opportunity. And it's not just access to hospitals, but access to perinatal care outside of a hospital setting. So I think freestanding birth centers are an opportunity for folks, especially in rural communities, to have access to health care. If we think about central and western Nebraska, those folks are driving 1, 2, 3 hours to access health care. That costs a lot of time. It costs a lot of money. So maybe those folks are less likely to seek care when they need it. And so on a state level, that's an opportunity for us to be able to help more people, is not getting rid of those maternity centers in hospitals, but maybe more clinics, more freestanding birth centers, more folks who are able to provide perinatal care, like midwives and family medicine doctors. I think the national stat is at one point, 45% of family doctors were providing obstetric care. And now I believe the national average is about 7%. So having more family practice doctors who are willing to train and also provide that care would be essential. Certified nurse midwives are also an opportunity to provide holistic maternal care, especially in more rural communities. So allowing them the freedom to do that outside of a hospital setting could certainly positively impact those communities who maybe have less access to perinatal care and support.
Let's talk about the local level now. What are some things you are doing and some things that you're seeing in the practice that you have? What are some of the things that you're noticing?
Yeah, I'm privileged to be, in the community and working directly with community members. So meeting with them face to face to talk about what their needs are, what their, experiences are, not only for themselves, but the people that they know in their immediate circle of influence. And also being able to serve on some of these community action teams about what those folks are noticing from the clinical side as well. So things that we're noticing is that these direct services are making a huge impact, not just with the education, but with doula support, with breastfeeding and lactation education. Those folks who are getting kind of those grassroots direct service supports we're finding are accessing some of those more social support programs as well. They're more likely to go into those offices to seek more support and care in that way. We're also noticing that they feel more informed and empowered and are sharing that information in their own circles of influence, which I think is really positive. And they're also advocating for themselves alongside advocacy partners, right? Going into those doctor's appointments, advocating for themselves or advocating with family members. And they're also more likely to engage in local and state level legislation. So we've seen with some of the bills come to the floor, those community members coming in saying, hey, this work is really important to me. Here's why we need, Medicaid doula coverage. Here's why we need postpartum doula coverage. Here's why we need, certified nurse midwives operating these areas outside of hospitals. So it's been really empowering and encouraging to see community members take back their own health and get more involved to make sure that their communities are getting the service and support that they need.
That's great. It's advocacy not only for themselves, but for others, which is important. I think it's important for everyone, and particularly policy members, to hear personal stories. Personal stories are always the thing that seems to move people and also give them more education. So that's really great. So you mentioned doulas. You've said that a couple of times. Let's talk about doulas. What are doulas, and what's the difference between a midwife and a doula?
Yeah, so doulas provide non-clinical support to pregnant and parenting families. And that support can look like physical support, emotional support, educational or informational support, as well as advocacy. So we're usually with clients from fertility, for folks who are trying to conceive, through pregnancy, labor and birth, and postpartum. So the most common doulas you'll probably hear about are birth doulas, who provide, again, those forms of support, talking about what their birth preferences might be, what they can anticipate through labor and birth, how to advocate for themselves, what information that they need to make, informed decisions, and then supporting them through those decisions. And then postpartum doulas provide that same support once families are home. So caring for this new human that you have in your home and learning them and figuring them out while they learn you and learn life on the outside. So those are the two primary doulas that most people will hear about. But our biggest difference between doulas and midwives is midwives provide clinical care. So very much like an obstetrician would provide clinical care to a pregnant or parenting person, they do a lot of that. Tends to be a little bit more on the holistic side, supporting physiological birth and typically low intervention. So not a lot of interference during the labor and birth process. Midwives can also provide women's health care, so doing annual appointments, those kinds of checkups as well.
Yeah. But the doula is such an important support piece. And so how do people become a doula?
Yeah, so you become a doula in a couple of different paths. There are many organizations across the country that folks can kind of research and see what organization most aligns with their values when it comes to supporting pregnant and parenting people. These trainings can last anywhere from 3 days to 16 weeks, depending on what kind of comprehensive education that you're looking for. Those trainings will usually have a number of different components, such as childbirth education, the stages of labor, interventions, postpartum care, physical comfort measures, looking at evidence-based research, Some programs even offer, herbalism and things like that, or, placenta encapsulation if that's your jam. So there are different organizations who do that, and then they have different requirements depending on if you want to certify or if you just want the training and education.
But are there, like within our community, are there certain doulas that are accepted or not accepted? Is there anything that, do you have to have certain credentials to be able to do that?
Yeah, so for most organizations, they prefer, at least for Malone Center, we ask that all of our doulas have an official certification. So that certification for many organizations usually looks like attending 2 to 3 births and having a provider or nurse sign off on those, as well as that client, and then a certification exam. So there is no state or national licensure in that regard. But most organizations will require a doula to be certified. However, for some community-based doulas, a certification is not a requirement to be a doula, but it does give you that added credibility.
Right. And what about insurance? Is that paid for by insurance, or do you pay doulas?
So most doulas are paid through organizations through grant and donor funding. Some doulas are covered by insurance. It depends on what coverage that you have. And if that organization will cover it. It gets a little tricky because some MCOs, will cover only for high risk. Some will only provide virtual doula support. So it's very limited. Right now in the state of Nebraska, our MCO or insurance coverage for doulas is right now in the kind of trial stage. So it's not fully covered quite yet.
Okay. So you couldn't depend on that, but you would be able to know from the beginning what the costs were and that kind of thing.
Correct, yes.
Yeah. Well, I think it's important that people know about doula services because it's something that for a lot of people they didn't know about. Mm-hmm. And so now that there is some information about it, it's such an important service that it's great that people are starting to find out more about it. Yeah. So if you want to get a doula, how do you do that? Like if you're going to go through pregnancy or whatever and you're interested in it, how would you access doulas?
Yeah, there are a couple different ways you can access doulas. First, through your provider, you can ask them if they know of any doulas or doula organizations in your area. They may have referrals. Lots of organizations here or doulas here have tried to build relationships with providers to be able to refer their patients to doula support services. There are organizations like Malone Maternal Wellness, IB Black Girl, and A Mother's Love that offer doula services or grants to pay for doulas. So there are different application processes for each organization for folks who may want that.
Okay. So that's a really important piece to have us also tell our audience so that they can know where they could get those services. That'd be great. Okay. Anything else that you can think of that would be important for us to talk about in this topic?
Yeah. I think when it comes to doula services, when people are determining if that's the right choice for them, the evidence shows that people who hire doulas or have doulas in their space are more likely to have better outcomes. They're much more satisfied with their birth outcomes, regardless how baby is born. There's a reduction in cesarean rates, reduces the risk of pharmacological pain medication and pain management, and you're more likely to have a vaginal birth. Which are all, great aspects for folks who are looking for that kind of support. And it's, I think, also a way for people to just get that extra support outside of family. I don't know if you've been in the birth space with family, but their support looks a little bit different than a doula's. It's much more emotional. And while a doula is emotionally involved with that family that they're supporting, they're able to take some of the fear around labor and birth out of that experience and provide really a sense of calm and peace, regardless of what's happening in that room when you're doulaing someone very well. Yeah. So I think it can be a great opportunity for folks just to have that little, even if you're well supported, it's always nice to have those extra loving hands in the room with you.
Yes, absolutely. Are there any other things you can think of that could help improve the statistics?
Yeah, I think there are a couple of things that would be helpful. Most people don't have preconception education. So what does it mean to deal with fertility issues and how to get pregnant, how to remain pregnant in terms of nutrition and things like that? So preconception education would be vital to adequate health care. I think additionally, for most people, once they are pregnant, aren't able to see their medical provider until 12 to 14 weeks gestation, which means most people aren't seeing their provider, until their second trimester. And in that first trimester, there's an opportunity there for one, more education, two, to build a healthy relationship with your provider earlier on. So that way you're more likely to see that provider throughout your pregnancy for regular prenatal appointments. And three, you can catch things maybe a little bit sooner that, may be preventable in regards to nutrition or taking care of your body while pregnant.
So for a woman to advocate for earlier appointments, is that something you think would be helpful?
Yeah, absolutely. They can certainly advocate. Keep calling back if you keep getting turned down. And if you're not getting the care that you need, you do have the opportunity to switch providers. You don't have to stay where you're at. So if you have access to anyone else, I would encourage shopping around for the right provider for you.
Well, thank you so much. I really appreciate it. This has been very, very enlightening and such an important topic. And do you feel like things are improving?
I think we're on the path to improvement. I think there's still a lot of work to do, but I think there are a lot of people who are committed to doing that work and putting plans into action and not just talking about it. So I'm looking forward to seeing how it'll all unfold.
Right. And I'm hoping that this program will help a little bit too.
I hope so.
Yeah. Women's Health is a program series hosted by the Women's Foundation of Lincoln and Lancaster County. So we want to thank them for this. And we really want to thank Sydney for being here with us today. It's fantastic information and we really appreciate it. My name is Kathy Ermacher and this has been Women's Health.